Hello, YouTube viewers. I am Dr. Tahir from Youthful Medicine. Welcome back to my channel. Um, as a rheumatologist and lifestyle medicine doctor, I see several interesting cases every day, and I thought that I should maybe discuss some of these cases, the complexity of their diseases, and how I try to kind of um, look into different problems and try to address them in a way that can help improve patients' quality of life. So I'm going to discuss with you a management of a case that I managed. It's a 78 years old female who's been dealing with multiple medical problems, and most notably a chronic kidney disease stage 3. And she also has what we call secondary hyperparathyroidism, high and other complications that she has related to this kidney diseases, hyperuricemia and gout as a result, and osteoarthritis of the knees. So let's tackle the first problem, chronic kidney disease and secondary hyperparathyroidism. So secondary hyperparathyroidism often occurs in patients with chronic kidney disease due to disturbance in their calcium and phosphorus metabolism. This can accelerate bone loss, increasing the risk of osteoporosis and fractures. That is why I recommend a DEXA scan to assess the bone density scan, and also reviewed her previous scans. Our discussions included possibility of medications. You may recall from one of the other videos that I talked about what medications are suitable for patients who have chronic kidney disease and which medicines are not suitable. So this patient is certainly not suitable for reclast, which is the IV zoledronic acid, but it is more suitable. Her suitable option includes Prolia, a medication that helps strengthen um, bones by reducing the ongoing bone loss. Remember, it does not make new bone. That's medication is called Avinity, which can be used in some patients um, based on their medical problem. You have to consider cardiovascular and stroke events risk in those patient population. So the second issue that I discussed with her is high uric acid level, called hyperuricemia, and gout management. So she came to me initially for gout attacks in her foot, her MTP, or the big toe joint. So this patient also has high uric acid, which is partially contributed from her diet, and also her kidney disease, which is she's unable to clear all her uric acid level. Her level initially when she presented was 11, and most recently it has come down to 9.3. So she is on a very low dose of allopurinol. We're talking about 50 milligrams every other day because of her kidney disease. So it's a lot different than what we would ordinarily treat a patient who have high uric acid and normal kidneys. Will be titrating up from 100 milligram daily up to 300-400 milligrams, depending on where we achieve the target, which is usually a uric acid level of less than 0.6. And my apologies for the background noise. There's some construction going on in our building. All right, so I recommended that we continue to monitor closely for her uric acid level. So I am suggesting that she takes um, a 50 milligram pill of allopurinol for another 2 weeks, recheck the labs, and uh, if it is still high, which I think it will be for sure, I would increase the allopurinol dose to 50 milligrams every day, or maybe add it up to like 5 days a week, so that I gradually increase the uric acid. The reason being is that allopurinol has an increased risk of side effects such as severe rashes and other complications, which can be dose dependent, and patients with kidney disease, you have to be very careful. So we'll be rechecking her levels. Her family was with her, and we just discussed about monitoring for any side effects. The other issue was that this lady, I mean, she's in her high 80s, 78-ish, and she has knee arthritis, and she has been suffering from osteoarthritis of both knees. And degenerative disease of the lumbar spine. So I suggested that we avoid medications like NSAIDs. She can use Tylenol and natural anti-inflammatory supplements, which I encourage all my patients to do. And I told her to focus on anti-inflammatory foods. But I'm also suggesting her cortisone injections as needed, intraarticular uh, and hyaluronic acid as well. So this is what is just a snapshot of a complicated patient who's an elderly, has multiple comorbid conditions, including chronic kidney disease, secondary hyperparathyroidism, and needing treatment for osteoporosis, and then high uric acid, leading to repeated attacks of gout. High uric acid leads to other complications of cardiovascular nature, such as increased risk of heart attack and strokes, and that's why addressing this is an important. But the caveat is that I have to be very careful because of her kidney disease. And again, mobility is important. She can't move much if her knees are hurting, and that's why I suggested treatment focusing on knee joint. I also gave her physical therapy order for making sure. So that's just a snapshot of it. So if you or your loved ones suffer from any of these problems, please share this video with them. It might be useful to bring these points of discussion next time they go to their doctor. And um, I would um, I would suggest that that you subscribe to my channel and also click on the bell for notifications so that when I upload a new video, you should be able to read it. And please welcome to give some comments if you have any. And I'll try continue sharing cases which might be of useful value to all my listeners. All right, until then, take care of yourselves. Keep moving. Take care.